So this is an abstract. There was an effort from our Kansas University consortium effort. And in this particular abstract, we looked at patients with relapsed myeloma who were daratumumab-naïve and received therapy with either daratumumab, pomalidomide, dexamethasone, or daratumumab, Velcade, dexamethasone. We had a total of 140 patients. 100 of these patients received dara-pom-dex, and the remaining 40 patients received daratumumab, Velcade, dexamethasone. And we looked at the outcomes in regards to safety and efficacy after receiving these salvage regimens. And we found that the overall response rates as well as the progression-free survival were very similar whether you received dara-pom-dex or dara-Velcade-dex after at first relapse. The median progression-free survival was around 11 months in each arm. We also looked at the safety outcomes, and we found that patients who received dara-pom-dex on average, have more cytopenias, including neutropenia, anemia, thrombocytopenia, whereas patients who received dara-Velcade, dexamethasone are at higher risk of having peripheral neuropathy. Cytopenias were seen in about 75% of the patients who received dara-pom-dex, and peripheral neuropathy was actually seen in about 25% of the patients who received dara-Velcade-dex. Again, at the end of the day, we did not see any significant difference in the progression-free survival. There was a difference in overall survival, with about 35 months in the group receiving dara-Velcade-dex and about 49 months overall survival in dara-pom-dex, but we were not able to see any statistical significance between the two groups.